you look at deformities, they can be the coronal plane, which is the scoliosis, and the sagittal plane, which is the kyphosis, and they occasionally, or I'd say often, are multiplanar, and so they are kyphoscoliosis. Scoliosis basically is of three types: congenital, idiopathic, and neuromuscular. Congenital is basically due to a failure of formation of the vertebrae. That means a hemivertebrae, one side forms, the other side doesn't. It might be a failure of a segmentation in which there is an unsegmented bar which on which side the scoliosis cannot, the spine cannot grow, and hence it's in the concavity, or a combination of both. And neuromuscular scoliosis is typically found in disorders like arthrogryposis, myelomeningocele, poliomyelitis, cerebral palsy, and so on. But more than 70% of the patients with scoliosis are basically idiopathic scoliosis, out of which SRS, the Scoliosis Research Society, is now classifying it into infantile, juvenile, and adolescent, depending upon the age and onset. Adolescent idiopathic scoliosis, AIS, is more than 70% of the entire gamut of pediatric scoliosis. Basically, there are two types of congenital anomalies, as I have discussed already. Either it's a failure of formation or it's a failure of segmentation. A failure of formation is a hemivertebra, and a failure of segmentation leads to an unsegmented bar. And the worst is in which both are together. For example, if you see this particular curve, this is a fully segmented hemivertebra which has the maximum growth potential because you have a Y-shaped disc space in which you can grow on both sides. And this is a severe form in which you have a fully segmented hemivertebra along with an unsegmented bar on the concavity, and this leads to malignant growth potential of this particular curve.